Hi. So I got these from Zenni. A friend of mine told me about Zenni. These are single vision prescription sunglasses. I got the lyrics from an old Rocky Horror Picture Show song, Rose Tint My World. So I got the fuchsia lenses. And I think these frames are so cute. So anyway, yeah, I got my hair colored this week. I had like 3 different doctor's appointments this week, and I realized that one of the situations that I have with medical professionals right now is having to explain to them how far, actually I'm going to wear these because it is a little bright, how far cancer treatment has actually come for stage 4 breast cancer people. Because I found myself having to explain to other people what, like what does Ibrance do, because I had to get off of it for surgery and so forth. And then I went to an oncology appointment this week and found out from my oncology's physician's assistant, the PA there, told me that they're starting to use Ibrance on like lower stage cancers now. So stage 2 or 3 breast cancers may be starting to receive Ibrance treatment in lieu of chemotherapy, so targeted therapy for lower stage cancers, which would be great news. But now, as far as questions about like how do you do a surgery, how do you have a lifestyle that can include other medical procedures more easily, so knowing how long it takes, like what takes longer to heal, like if you're off Ibrance, and how long to stay off of it after the surgery, and how long to just all of these things. When I called the pharmacy, they didn't know the answers either. They had to have a powwow with my oncology department. And then meanwhile, the physician's assistant for the plastic surgeon wants me to go right back on Ibrance and is like, do it now, it's fine. And when I told him that I didn't necessarily just take his advice, I was taking multiple people's advice and getting it from like oncology and from the pharmacy and from him as part of the decision, he seemed to get kind of upset, or at least shorter with me. Like, he actually said, what does a pharmacist know about wound closure? What does an oncologist know about wound closure? Okay, so right then at that point when I told my PA about that from oncology, she said, would you like to just get your wound care here in Appleton, have it instead of driving all the way to Oshkosh? And I said, yes, please. Because in my experience, medical care they should have each other's backs a little bit and be willing to research these new things that have never happened in their experience before. They should be willing to have intercommunication and not be fighting against each other. When I feel like my medical professionals are arguing with each other over what's the right way or whatever, that makes me hella nervous. Really, really nervous, and it makes me kind of worried that they're not stopping and listening and taking their time to really try to heal. They're talking about their egos at that point. If you're a medical professional and it bothers you that someone else is getting information from other people in your circle of medical professionals, like if you don't want them to seek out the information from your colleagues, then you're not in this to really heal people. You're in this for ego, And I want, if it's your health, you want the best information possible from everyone who's willing to give it. So we kind of have to be our own advocates for that. And, when I went on the message boards at one of the smaller cancer groups on Facebook that I'm a part of, I didn't get many responses, but unanimously they were all like, yeah, follow your gut. We sometimes know more about what's going on here than the so-called professionals or experts, because we're the ones that they're trying these drugs on. We're the ones experiencing the side effects. We're the ones who've been through the surgeries, and we're the ones who have the diagnosis. So don't count yourself out. If your gut tells you, call the pharmacy. Call the pharmacy. What could it hurt? So when you have your professionals all communicating together in that same circle, that's when you're getting the best medical care possible. But when they're all cutting each other off or trying to fight over who's doing what, and it gets to be like this little ego thing of like whose advice you're going to take, I'm going to take a whole survey and go by what gets the best overall, you know, like, can I go back on Ibrance? Will this still continue healing? Until somebody else who's done this can give me a clear answer of how long it took them or their patient, I'm going to keep asking. So anyway, the pharmacist got back to me and said, yeah, we talked to your oncologist. They're going to start looking at the wounds too and make a decision, because nobody else in our database has had a breast reduction while they're on Ibrance. So we're just going to take this one step at a time, because my oncologist's PA and I have been talking about this for years, like at least 2 years before I even had the surgery. I was losing weight. I had to lose 50 pounds, so that took a good year. And I see her every month, so we've been discussing this ongoing. She and I made a plan, and I'm following that plan. But this complication was a little hiccup, not expected exactly, but and I'm grateful to the surgeon who did the surgery, because I still haven't had much pain, neck pain or back pain since then. But I still feel like this is a really important thing to discuss with patients and with medical caregivers, that you want your medical caregivers to communicate with each other and not shy away from that, and not use their ego to be like, oh, but I said, or what does oncology know about wound care? I don't know. Just a few thousand patients that get surgery just even for diagnostic reasons. So, long story short, I like my new hair color. I love my new glasses, and I'm going to get new wound care somewhere else, because I think that the plastic surgeon did great on the surgery, but this wound care thing, I just got a really weird vibe from the guy last couple times I went, and it's not the plastic surgeon's fault. It's not the clinic's fault. It's just this one PA whose personality doesn't vibe with my personality. And maybe that works great with some other patients. Maybe some of his patients are like, yeah, I love this guy. He's amazing. But my experience wasn't amazing. So, he was all right at first, but when the guy who says, what's Ibrance, comes in the very next appointment and is all like trying to finish my sentences for me, it might be time to keep shopping for someone else to help with the wound closure then. So, but Dr. Dubeck, who did the surgery, he has an office here in Appleton, so I'm going to try to see if I can just go to Appleton, either that or there's a wound care specialist at Appleton Medical Center, and that they can probably just see me there. So one of those two things, but nobody in Appleton, nobody in my region has ever heard of this happening before. As far as like metastatic breast cancers, that stage 4 breast cancer patient, stopping their targeted therapy, staying on letrozole Lupron, because that's my hormone therapy. So I stayed on that throughout the whole thing. So we're still starving the cancer and whatnot. But nobody's really heard of this other than that. That's the plan that my PA and I came up with from oncology. So, and also nails, check these out. Oh, focus, please. Focus. It's not gonna focus. Okay. Let me try something else here. Nails. Okay, well, they're plaid, and they have butterflies, and that's the news for that. Okay, so anyway, yeah, I did the pink because of Pinktober and breast cancer awareness, and I like it. And it's fun, and because I'm off Ibrance, they could go right up to the scalp with the dye with no risk of any kind of extra side effects. So I thought, since I'm not on Ibrance, do it up. So I got the whole curtain thing going on in the back where it's pink and my natural red. And I just adore it. I'm having so much fun with it. And let's see, anything else? No, that's it. So that's been my week, my whole week. And then also, just a quick note. When you're friends with somebody, it can help a lot. If they're doing something that bothers you, tell them. Don't just let it get upset in you, because recently I learned that I did something that upset somebody way more than I would have realized. And I'm ADD kid still as an adult. And I gotta say, it hit me from out of left field when I learned how much I hurt that person by just, my own silly Sarah stuff. And I wish that person had told me, rather than carrying it with them and venting about it and worrying about it and freaking out about it. I wish they would have just told me on the spot, because sometimes I can just modify my behavior right then and make it so that it goes away and nobody has to get hurt. And if I had known that it was going to bother somebody, I would have just stopped. So let people know when they're upsetting you, please, because, that's my gig. I might drive some people crazy, so... Oh, there's Molly. Hey, Molly. Yeah, I might... So, for what it's worth, just an I'm sorry isn't enough sometimes. Sometimes it needs to be something spoken in that moment so that the I'm sorry can come right then. Right then. I'd rather that than feel like I hurt somebody. So, that's a terrible feeling to know that after the fact, and not when I could have done something about it. So keep those lines of communication open. Have a great day and be kind to yourself and others. Bye.